So this is Dr. Goel, MD Medicine, DM from top medical schools in Delhi, and also MD USA and DM USA. Like to continue, in a, if we have high blood sugar also, and most, these days we all seem to have diabetes and blood pressure. I have a family history of diabetes, and let me tell you, everybody after age 40 will have blood pressure because kidney are the one who maintain blood pressure. They get rid of salt and water or retain salt and water to maintain blood pressure. But after age 40 they start losing some function, and then blood pressure starts going up. And higher blood pressure damages kidney even more, and then blood pressure goes even higher, and it becomes a vicious cycle. And we need to break that vicious cycle. Only way we can do is by checking our blood pressure regularly, and controlling the blood pressure. So our normal blood pressure, usually traditionally we call it 120 and 80 upper number systolic. When heart contracts, pushes the blood out, blood pressure goes up to 120, 125. And then it comes down, doesn't come down to zero, it comes down to the 80 millimeter of diastolic blood pressure, because it's very elastic heart and the blood vessels. So upper number, we sometimes we call it upper number, and the lower number. So basically, lower number, stays at 80, doesn't goes to zero because of the elastic recoil of the blood vessels, and the elastic recoil of the blood vessels. So we all have, few millimeter here and there. If we check, most of the time our body will maintain that normal blood pressure, and that is our usual blood pressure. Just like weight, we all know our weight. It can go up, but initially body, the body try to stay at that weight, but then again it can go up if we change anything. Anyway, so let us not be technical about it. So we'll just consider normal blood pressure to be 120 upper number, and lower number to be about 80. And it's called systolic and diastolic blood pressure. And when it is above our normal usual blood pressure, we 130 over 90, definitely you have a blood pressure. Then we call it a high blood pressure, or in India everybody calls it a BP, or medically hypertension. So how our body reacts to higher blood pressure? There is no question. We all know that our heart has to work harder and harder to push blood, and so it becomes thicker. And unfortunately, while it's good for our muscles of our arms and legs to become stronger and thicker, it's not good for the heart, because the heart has a very limited blood supply. So it cannot afford to be thicker and bigger. And not only that, high blood pressure, starts affecting our kidney, start damaging our kidney. And like I said, it creates a vicious cycle. Damaged kidney, raises the blood pressure, then higher blood pressure damages kidney. But it happens so slowly, it happens over years. I have to tell you that I cannot forget the time when there is a 40-year-old mother of two youngs with her husband came to consultation with me. This was in Gurgaon. I was going back and forth to spend time with my mother for about 2 months. So I set up a clinic in Gurgaon. They came to me, and so husband told me he has been told his wife has already lost 70% of the function, and all she has is high blood pressure. She has no other symptoms. So I was taken aback. She was a youngish mother, and so I told him we can stabilize the kidney function. Maybe we manage a good control, so she will probably have another 3, 4, 5, 6, 7, 8 years. Or we can make it a very slow process, but we can't bring her numbers, kidney function back. This is true about kidney. So then so I started, explained everything, started, I started like, they were taking medication, explain everything, how important it is to control the blood pressure. And obviously we don't want to bring blood pressure down suddenly. High blood pressure, we bring it slowly, we increase the medication. But in few days, he came to clinic and he told his wife crashed, and she just had to go. I mean, she became unstable and she has to go on dialysis. She was in a hospital, and they realized her kidneys have failed, and so he was really crying and telling me that he did not know how to pay for dialysis once you discharged from the hospital. Dialysis is very costly in India. In US, government has passed the law. Anybody whose kidney fail and needs dialysis, and one of us kidney doctor writes it, that patient will be on dialysis always. Then our government automatically, this passed a law long time ago, government automatically takes over his care and pays for all the dialysis and all the dialysis for the patient. And it's such a blessing, you can understand, it's such a blessing for all the Americans, because everybody in these days seem to have diabetes and blood pressure. I was dialyzing 22, 30 to 40 patients. They come for dialysis. They come in shifts. So have almost, I would say, 80 to 90%, almost 90% of patients, they have hypertension and diabetes. So diabetes also damages kidney and raises blood pressure, so it becomes a vicious cycle. When we grow old, not just one thing changes, like slowly, so many things changes in our body, in our looks, and our hair color, etc., etc. So this is inside the body, what I'm telling you, the things are happening.